Abortions in overall India, actually, ladies and gentlemen, have risen sharply over the past 5 years, up by 67% nationally. But in the south of India, the surge is far steeper, with Telangana topping the charts at a staggering 917% jump, as reported in South First. Official data from the Union Health Ministry's Health Management Information System shows medical terminations of pregnancy climbing from 5.3 lakhs in 2020-21 to nearly 8.9 lakhs in 24-25. Telangana, India's youngest state, recorded the sharpest spike from just over 1,500 cases to more than 16,000 in 5 years. Karnataka, Andhra Pradesh, Kerala, Tamil Nadu also reported growth rates well above the national average. Experts say, well, the surge is partly due to increased reporting and access to authorized facilities, but is also tied to deeper socioeconomic factors. The paradox is higher education levels and greater economic participation amongst women, which also influence whether to have a baby or not. Doctors say, with rising living costs and career priorities, many families are consciously opting for smaller families or perhaps delaying childbirth. Now, Karnataka saw the highest absolute rise in South India, more than 42,000 additional cases in 5 years. Tamil Nadu remains the highest volume state in the south, performing over 1 lakh abortions last year, supported by the country's largest network of authorized facilities. Both Kerala and Andhra Pradesh recorded sharp increases as well. The times are changing. Of course, like I said, you and I cannot sit on judgment on who, why or where. Where is important, but who, why has an abortion. But then what is the overall impact of it? Dr. Anupama R., senior gynecologist, reproductive medicine, is joining us, and also Dr. Rachna Khanna Singh. I got her because one has to understand the mental health aspect of this entire story. She's, of course, a mental health counselor. Let me welcome both the ladies to my show. Thank you so much for making the time.
Thank you.
Dr. Rachna Khanna Singh, let me start with you. You know, when miscarriages happen, I've seen a lot of women really kind of crumbling, taking time to come to their own, because it's a loss. It's part of your body. It's for men, maybe it's theoretical, but for us, it's practical. And it does create a lot of trauma. I've seen a lot of women, you know, and one gets pregnant. I have 2 children, so one knows that, you know, you get pregnant, you're very scared. I should be able to keep it. I'm going to eat well. I'm going to think. So it's like preserving another life inside you. When you abort, and I know a lot of women who aborted more than 3 times, what is the impact on the mental health of a woman? Dr. Rachna Khanna Singh.
Yes, so there could be 2 reasons. One could be, of course, there's unwanted
Sure.
pregnancies, which is something which we see again, which still also brings about a lot of guilt alongside a lot of parental pressure, a lot of society pressure, a lot of secrecy, a lot of fear. Those are very difficult emotions to deal with. Guilt, in fact, guilt, remorse are one of the worst emotions to deal with. And then, of course, we see a group of people where there are married women and then they are subjected to either go for an abortion or either due to medical reasons or again because of society pressure as well. Then again, we see that there's a massive amount of strain on the relationship, on the marital relationship as well. A woman is not able to express the emotion properly, the emotion of loss. Effectively, there is a sense of loss, like exactly what you said, that it's a part of your body, it's a part of your mind, and people, a lot of women feel a part of their soul going away, with their medical termination of pregnancy or abortions. And of course, there is the sad truth is that since there is not sufficient sex education all over, so there is not much understanding of healthy contraception and how all these can be avoided. So at some level, now all I'm just saying is that we need a lot more psychoeducation, whether it is at the preventive mode, at the sex education mode, where there is psychoeducation, where we can actually explain what is happening, because a lot of times, because of genetic reasons, the fetuses have to be aborted
All right.
as well.
Yeah,
Which
that I
but
understand
having
totally,
said
and I'm not here to sit on judgment, Rachna, because I said that very clearly. But then there is a mental impact, where
Absolutely.
where you have to sometimes, do it. And you know best, I know best. I mean, who's anybody else? But then I just want to understand, because I've seen women battling trauma even after 20 years of having aborted a child,
Correct.
which
So
was
there is a huge sense of loss, and it's more like a PTSD where there's a post-traumatic,
yes,
syndrome.
absolutely.
It's
Yeah, yeah.
absolutely, and also, the point here being that whenever a woman is going through difficult things like abortion or IVF, it should become a mandate for a mental health professional to
Yeah.
give at least one or two consults so that the process becomes a little
All
easier for
right,
the
let me
woman.
come back to you, Dr. Anupamar. Thank you so much for your patience, doctor, for waiting up. I want to understand. There are different aspects to it, but I mean, there is of course, women are working, prioritizing work and career, and they have money, they have deciding power. It's their body; they will decide. But do you think we're still lagging behind contraceptive knowledge? Do you still think, I'm not just talking about the urban women who are talking about, oh, I'm ovulating now and I'm doing this now, but overall, women do not still know how to be smart about getting pregnant. They get pregnant and they do not know what to do about it.
Sure. Thank you for this opportunity. So definitely the most important reasons can be one, most of our married couples, they are also opting for a single child norm, and there are living together relationships. There is a surge of extramarital and premarital and all sort of relationships, and there are sexual relationships among adolescents, and all these things are rising in the community. So, of course, as part of it, most of even the married people are not aware of the good contraceptive options. Then certain people, or one fraction may not be much aware about the contraceptive options. Another fraction may not have a clear perception about the various contraceptive options, and a third group will be reluctant to accept the contraceptive options. So these are the three different groups regarding the acceptance of contraceptive options.
All
There are
right.
a lot of very patient-friendly contraceptive options nowadays available, and definitely most of the gynecologists explain to the patient, explain to the ladies at some point of time. So either after delivery or when they are seeking any contraceptive options soon after
Tell me
marriage, they are
something,
not.
yeah, Dr. Anupama, I also want to know quickly from you that if you have multiple abortions, a married woman, educated woman, working woman, but she's just gone wrong, and sometimes it's just, a lot of reasons. We all know what the reasons could be. How much does it really impact her body, her reproductive organs and her body as a whole? 4, 5 abortions. I've known a lot
Yeah,
of
sure,
people.
sure.
My house help.
Yeah, sure.
6.
That's a very nice question. So it definitely can create a bad impact on her reproductive health. Especially there are chances of repeated abortions and all can produce chances of tubal factor infertility, damages tubes, pelvic inflammatory diseases and all. All this can make her more infertile in future, and more chance of chronic pelvic pain also. And because of the damages this abortions has caused to the pelvic structures, that means especially the fallopian tubes. Then second thing, because of the repeated abortions, repeated curettage, repeated medication use and all, there are chances of adenomyosis. That means a bulging of the walls of the uterus. So it's another common condition which we see nowadays, and that can produce severe pain and bleeding after 40s and all. And similarly, most of them might end up in a hysterectomy. That means a uterus removal by around 40, 45.
All right.
And all these things can happen.
Yeah, I just have
Definitely.
1 minute left. Dr. Khanna, quickly, if you can tell me that do you think that at least women who have access to mental health counselors should seek some counseling if they are feeling disturbed and facing trauma after a very well thought out abortion that they go through?
Absolutely. In fact, even if they are not feeling the disturbance at that time, a lot of times it may appear later. So it's a very important thing to have one consult as a necessity for for a mental health counselor to assess if there has been an overload of any kind of an emotion, or there is any aftermath of the process which has effectively taken a toll on the mental health of the woman, or anticipated to take a toll on the mental health of the woman, because a lot of times at
All
that
right.
moment we are able to hold fort, but later on we might crumble. So
On
it's
that
very
note.
important
Yes.
so that we don't go into any depression or anxiety or any other
All right.
disorders later.
Okay.